Gentlemen, let me ask you something honest. Have you ever been in the middle of intimacy, wanting so badly for your partner to feel that same rush of pleasure you're feeling, but you notice she's not quite there yet? Maybe she enjoys the closeness, but climax seems harder for her to reach, or sometimes doesn't happen at all. You're not alone. Studies show that while most men climax during intercourse, a large percentage of women don't, at least not without the right kind of stimulation. So here's the million-dollar question. Is there actually a way to boost her chances of orgasm without guesswork or awkward trial and error? Well, science has some answers. In fact, researchers have literally measured blood flow to the clitoris in different positions. And yes, some positions make a dramatic difference. Today, I'm going to share with you the 4 best sex positions for female orgasms, backed by real science. And stick with me until the end, because I'll also share bonus techniques you can use in any position to make intimacy more satisfying for her and for you. But before we dive in, help me out. Tap the like button so more men can see this important information. And let me know in the comments, where are you watching from? I love seeing men from all around the world coming together to improve their relationships. And of course, hit subscribe, because every week I share science-backed advice to help you stay strong, healthy, and confident, both inside and outside the bedroom. All right, let's bust some myths. For decades, men were told that penetration alone is enough for female pleasure. Movies, magazines, even locker room talk have painted this picture that if you just last long enough, she'll be satisfied. But here's the truth, and it might surprise you. Most women don't orgasm from penetration alone. That's not because you're doing something wrong. It's because the majority of a woman's pleasure comes from the clitoris, a structure with over 8,000 nerve endings, many of which aren't even touched by penetration unless the angle and position are just right. So here's the myth-busting truth you need to hear. Some positions naturally give her more clitoral stimulation than others. This isn't about luck or magic. It's biology, it's blood flow, it's physics. And yes, researchers have literally mapped this out using ultrasounds and 3D imaging, which means that with the right knowledge, you can dramatically improve her odds of reaching orgasm without needing to be a mind reader. And that's where I come in. If this is your first time here, let me introduce myself. I'm Dr. Nerita, a urologist with 12 years of experience helping men and couples restore confidence and intimacy in their relationships. I've seen firsthand how these conversations, though sometimes awkward, can change lives. Because let's be real, when a woman struggles to orgasm, it doesn't just affect her, it affects both partners. Frustration builds, confidence drops, sometimes couples quietly accept, this is just how it is. But science tells us that's not the case. In fact, in a 2022 study, researchers asked couples to try different positions while measuring clitoral blood flow with ultrasound. The results showed clear winners, positions where women had significantly more arousal and higher chances of climax. And that's exactly what I'm going to break down for you, step by step. Let's count down the top 4 sex positions for female orgasm based on science. And I'll explain each one in 3 ways. Biologically, what's happening in her body; emotionally, how it impacts confidence, intimacy, and satisfaction; practically, what it looks like day to day in your bedroom. Position number 1, woman on top, face to face. This one is a classic, and for good reason. Biologically, in this position, the woman controls the angle, depth, and rhythm. Ultrasound studies show this leads to dramatic increases in clitoral blood flow, especially because her body naturally presses forward during movement, adding direct stimulation to the clitoris. Emotionally, for many women, being on top creates a sense of empowerment. She feels in control, she can adjust in real time, and she doesn't have to silently hope you'll change the rhythm. That confidence translates into relaxation, and relaxation is key to orgasm. Practically, think of it as handing her the steering wheel. You provide presence and connection, but let her lead the pace. Some men struggle at first because it feels different not being in charge, but remember, the goal is shared satisfaction. But wait, this isn't the only position where small changes make a big difference. Position number 2, missionary with a pillow, face-to-face, man on top. At first glance, missionary may seem basic, but science shows a simple adjustment can transform it. Biologically, placing a pillow under her hips tilts the pelvis upward, aligning your body so more of your weight and thrusting motion press against her clitoris. Ultrasound imaging shows a significant boost in clitoral blood flow when this adjustment is made. Emotionally, for many women, missionary feels deeply intimate. Eye contact, closeness, kissing. Adding the pillow doesn't take away that intimacy, but it adds stimulation that makes orgasm much more likely. Practically, keep an extra pillow nearby. Not the flat head pillow, but something firmer. Slide it under her hips at the right moment. It's simple, discreet, and effective. But maybe you've heard of a position that's not just an adjustment, it's almost a technique. Let's talk about that. Position number 3, the coital alignment technique, CAT. This one isn't as well known, but research shows it can be a game changer, especially for women who struggle to climax from intercourse alone. Biologically, instead of thrusting in and out, both partners shift slightly higher, so the base of the penis or pubic bone presses against the clitoris during penetration. Then, instead of thrusting, you rock together in a sliding motion. This creates sustained and targeted clitoral stimulation throughout. Emotionally, couples who master this often describe it as feeling like a dance, moving together in rhythm instead of one leading and the other following. It can deepen connection and reduce performance anxiety because the focus shifts from how long can I last to how well can we move together. Practically, it takes communication and patience. The first few tries may feel awkward, but don't quit. Talk, laugh, adjust. Once you sync up, the pleasure is intense and often leads to her first orgasm during intercourse. And finally, there's a position that combines intimacy with face-to-face connection, though it's not quite as powerful as the others. Position number 4, sitting face-to-face. This position may not rank at the very top for blood flow, but it has unique benefits. Biologically, sitting upright, facing each other, creates moderate stimulation for the clitoris, but not as much pressure as positions with gravity pushing downward. Emotionally, where this shines is intimacy. Eye contact, kissing, talking, it's one of the most connected positions you can try. For many women, feeling emotionally safe and close makes orgasm much easier to achieve. Practically, try this on a sturdy chair, edge of the bed, or even sitting on the floor with pillows. It may not deliver the same level of direct clitoral stimulation as woman on top, but the closeness can make up for it. Now, positions matter, but techniques are just as important. Here are 3 strategies you can apply in any position. Angling. Adjust the hips or pelvis slightly to change pressure points. Even a small tilt can make stimulation more direct. Shallowing. Focus stimulation near the entrance of the vagina, where nerve endings are densest. Don't assume deeper is always better. Pairing. Add clitoral stimulation during intercourse, whether with a hand, a toy, or encouraging her to touch herself. Research shows up to 70% of women find this dramatically increases pleasure and orgasm likelihood. Think of these as tools in your toolbox. Positions set the stage, but techniques ensure the show goes well. Now, maybe you're thinking, Doc, I've tried everything and my partner still struggles. Maybe it's hopeless. I want to reassure you, it's not hopeless. Every woman's body is unique. What works perfectly for one couple might need adjusting for another. The real secret isn't perfection. It's curiosity, communication, and patience. When your partner feels that you care, that you're not rushing, that you're exploring with her, that's when intimacy becomes powerful. And gentlemen, your worth as a man is not measured by how quickly or how often she climaxes. What matters most is how present, attentive, and connected you are. Orgasm is wonderful, but intimacy is about much more than that. So let's bring it all together. Woman on top, maximum control and stimulation. Missionary with a pillow, classic intimacy, upgraded, coital alignment technique, scientific precision for clitoral pressure, sitting face-to-face, deep connection, emotional intimacy, add in the bonus techniques, angling, shallowing, and pairing, and suddenly, you're not just hoping she enjoys sex. You're actively increasing her chances of orgasm based on real science. Gentlemen, age is not the end of passion. Your body may change, your partner's body may change, but connection, pleasure, and intimacy are always within reach. Small adjustments can lead to big improvements. If this video helped you, please like it, subscribe for more science-backed tips, and share it with a friend who cares about keeping intimacy alive. And before you go, tell me in the comments, which of these positions or techniques are you most curious to try? I'm Dr. Nerita reminding you, take care of your health, take care of your relationship, and never stop learning because you are worth it.